Hi, my name is George Rader, and this is our group assessment comparison analysis. Next up speaking will be Dana.
Hi guys, my name is Dana. I'll be talking about the VB map. It is an assessment for ages 0 to 4, and it compares the child's skill level, what they have now compared to where they should be developmentally by their age. It also assesses barriers to treatment and like problem behavior and like deficits, like motor deficits. It is 170 items across 3 developmental levels, and you are assessing the child based on where they fall in those levels. And up next, we will have Mackenzie.
Hi everyone, I'll be discussing the ABLES. So the age range, it's recommended for all ages, but it's mostly used on those from ages 2 to 6 years old. It's an assessment of basic language and learning skills. It has 25 different skill areas. Basically, an instructor provides a stimulus to a child and assesses the child based on what they do or do not do with that stimulus. It assesses their behavior with it. And the amount of categories it has is 25 different categories. They include language, social interaction, self-help, academic, and motor skills. Next, I'll pass it over to Yanira.
Hello, everyone. So the BB map does not have to assess a child on every category. It's broken down into 3 levels, and the child will be assessed based on their current skill level. So the way this helps determine intervention is that skill areas with low scores can be put into programs until they're probed out and worked on. And then newer skills, harder skills can then be put into place. Some pros of the BB map is that it addresses the function of behavior and the results can be translated into goals and objectives. Cons, there is no really like published data on the reliability and validity of the BB map, and it's only limited up to the developmental milestone of 48 months. Next with ABLES is Rachel.
So the ABLES, you do need to assess a child in every category of the assessment. And then it helps determine intervention because the included guide details how to design IEP goals and objectives to address the learning needs determined by the assessment. Some pros, the results are easily translated into IEP objectives, and it's specific to various classroom settings. Cons, it does not assess coping skills or other barriers to treatment, and it does not provide age norms. Up next is Bethany speaking about our case.
Hi everyone, I am Bethany and I'll be talking to you guys about our case example. His name is Timmy. He's a 4-year-old who was recently diagnosed with autism but has had no prior early intervention. He's able to produce some basic sounds and hum, but he has poor joint attention. He's able to respond to his name by orienting his body or looking toward the speaker when called. He is able to imitate 3 to 4 gross motor actions, but he does not engage in any interactions with any peers or siblings. He doesn't respond when asked to match items, and he does engage in problematic behaviors such as head banging, pinching, and dropping to the floor. And these are things that interfere with his learning. So when thinking about our 2 assessments, the ABLES and the VB map, when trying to pick the best one for Timmy, we decided on using the VB map because he's lacking the typical developing language and communication skills of a 4-year-old, of a typically developing 4-year-old. So with the VB map, we'll be able to meet him at his current skill level and then compare it to other developmental milestones and see where he could be or what needs to be, what prerequisite skills or what needs to be taught so that he can reach those developmental milestones. So this, like I said, the VB map will help identify what barriers he is having to skill acquisition. And then we will be able to assess and then put those things into programs. So next, George will talk a little bit more about that.
So the next steps is the assessment will take approximately 4 to 10 hours spread over multiple sessions, and the results were determine the current functioning level and guide what skills to teach. After analyzing the results, we can start developing a treatment plan for Timmy, and Timmy's progress will be monitored and reevaluated every 6 months. This is a slide of our references where we got the information for our presentation. Thank you for watching.